Hi everyone. Today we will discuss about annual TB report 2020. Recently, Health Minister has released the annual TB report 2020 through a virtual event, and this is prepared and published by the Central TB Division, Ministry of Health and Family Welfare. So, if you are looking into the details of this report, over 24 lakh TB patients has been notified, and about 79,144 deaths happened due to this tuberculosis in 2019. And there is an increase in 14% of TB notification as compared to 2018. And one of the positive point is that the missing cases, which was 10 lakhs in 2017, has been reduced to 2.9 lakh case. So this is a very positive point because if TB patients are missing, it is not possible to give proper care to them. So in this year, that is in 2018, this missing cases has been reduced to 2.9 lakh. That's very a positive development. Okay, and in case of children, the diagnosis to that, there is an increase in 8% in 2019 compared to 6% in 2018. And regarding the HIV testing, actually this HIV is in most of the patient HIV will be coming along with the TB. So this combination has been increased from 67% in 2019 to 81% in 2019. So from 2018 to 2019, there is it is increased from 67% to 81%. And the best point is that there is a 12% improvement in the treatment success rate of notified patients. So, and this is mainly due to the expansion of treatment services. So this 12% improvement is a very important thing for us because there is that much patients burden has been reduced. Okay, and if we are checking the performance of the state, there is 3 divisions or 3 categories with a 50 lakh population on one and less than 50 lakh population on the other side, and union territories also. So in the category of 50 lakh population, Gujarat is the first, and second goes to Andhra Pradesh, and then comes Himachal Pradesh. And then states with less than 50 lakh population, Tripura is the best performing states, and then comes Nagaland. And in case of union territories, Dadra and Nagar Haveli performance the best, and Daman and Diu comes second. Okay, and if we are checking the number of cases, in that report it is said that over half of the total TB cases were notified from 5 states, and those states are Uttar Pradesh with 20%, Maharashtra with 99%, then Madhya Pradesh with 8%, and Rajasthan and Bihar with 7% each. So the main 5 states with the TB burden are Uttar Pradesh, Maharashtra, Madhya Pradesh, Rajasthan and Bihar. Okay, so and if you are checking the government stands about the report, actually government is committed to eliminate tuberculosis from the country by 2025, and you have to note that in the sustainable United Nations Sustainable Development Goals 3, it is said that TB epidemic must be end by 2030. So India will be eliminating TB from India, from our country by 2025. That is 5 years ahead of this global target under sustainable development goals. Okay, so you have to note that under which goal this TB is coming. So under goal 3 of United Nations Sustainable Development Goals, they have ending of TB epidemic. Okay, and another point you have to notice that earlier it was RNTCP. So this RNTCP has been renamed as National Tuberculosis Elimination Program by the starting of 2020. So when the 2020 started, they have renamed this RNTCP as National Tuberculosis Elimination Program. Okay, so now it is NTEP, that is National Tuberculosis Elimination Program, instead of RNTCP. You have to note this point. Okay, and all this information they have collected using NICSHI. NICSHI, you may be knowing, this is formed. This term is formed by two Hindi words, that is NICSHI, that is Ni is one word and Kshay is another word, which means that eradication of tuberculosis, and which is launched in 2012. And this is developed by NIC, that is National Informatics Center, and Central TB Division. Okay, Actually, this is a web-enabled application, usually which is mainly deals with the creation of data, okay, based on all TB patients. So what the main aim of this is that is database will be created and this data will be used for research. That is the main aim of this Nikshay, and this is implemented at national, state, district, and tuberculosis unit level. So when they have categorized, there is one more thing, that is tuberculosis unit level. That is very basic unit of this tuberculosis management system. Okay, so what they are doing is you will utilize SMS. So instant SMS will be sent to the patients of TB when they are registered. Okay, they will be given a registration ID and details of DOTS operator, that is the treatment of this TB, and advice note on medicine. Everything will be sent to them. Okay, they are mainly depending on SMS, and every data of them will be collected through SMS, and any information if they want to give to the patients, that also will be given through SMS. So public sector as well as private sector also has to give information about their patients data to this Nikshay. That is why I already told you we have the number of missing cases has been reduced rapidly. So this is one of the important point of that this kind of initiative has helped to reduce that missing cases to a rapid level. Okay, so this helped to mainly to reduce the missing cases also. And if you're checking the way forward, main important thing is that we have to avoid stigma, because mostly nowadays TB patient, one of the important challenge that the TB patients facing is stigma. Most of the people will be avoiding them. So in order to enable their proper treatment, first we have to avoid a stigma, and they should be ensure that their treatment is given properly, and also care should be given properly. Care means care should be given with a dignity and without any discrimination. Okay, that is will be reducing their mental problem, mental distress. A lot of when a person is diagnosed with TB, they will be having a lot of mental issues due to this stress. So when this stigma can be avoided, a lot of issues, mental problems can be avoided due to this proper care without any discrimination. And also another important point that we have to do is greater engagement of the private health sectors. I told you that with the Nikshay, the private sector health care management has been very much involved in the treatment, and they have already increased the notification by 35% with the 6.78 lakh TB patients notified. So whenever a patient is going and getting consultation at the private healthcare sector, they will be notifying that patient to the government. So that the proper registry of that patient can be maintained, and their treatment also can be followed up properly. So their participation has improved this level of treatment, and the level of treatment success, ensuring their treatment level success also. So their participation is very important for tackling this TB problem out of India. Okay, so that's all. Thank you.